When normal labs miss the mark, you've been told everything is within range, but you still feel exhausted, inflamed, or off. What's going on? This is an all too common scenario we see at Bioprime. Many autoimmune diseases start with vague symptoms: fatigue, joint pain, bloating, rashes, but the standard protocols ordered in conventional care are limited. At Bioprime, we use advanced autoimmune and inflammatory markers that dig deeper. These may include ANA with reflex panels, thyroid paradoxase antibodies, anti-CCP, tissue transglutaminase, complement proteins, and even cytokine profiling. The goal isn't just to label the disease, it's to identify the early triggers. These may include gut permeability, environmental toxins, micronutrient imbalances, or chronic infections. We build an individualized protocol that may include dietary modulation, targeted supplementation, and when appropriate, immunomodulatory support. Patients often experience significant symptom reduction within the first 90 days, not by masking the immune system, but by rebalancing it. If you've been told nothing is wrong, but your body disagrees, it's time to go beyond surface level labs.